Hello, my name is Logan Heimann. I will be doing a newborn assessment video. Upon entering the room, I will be washing my hands. From there, I'm going to make sure that this infant that I'm going to be taking care of is the actual infant that I am assigned to assess. I would note that by an armband or the footband here, this is the correct infant that I will be assessing. After noting that, and making sure that the infant stays warm, I would want to get its vital signs. From there, I will uncover the baby, and I'll take out this thermometer, cover it, put it in the baby's armpit, hold it steady, and the average temperature for a baby is 97.7 to 99, and then I'll have my hand on his chest counting the respirations. Normal respirations for a child is 30 to 60 per minute. The temperature was 98.2 and the respirations were 45. Those are within normal limits. From there, along with getting the vital signs, I will be listening to his breath, heart, apical pulse, and bowel sounds. Warm up the stethoscope. Listen above the nipple line. Full breath. And then for the bases, you would want to listen underneath the arm. Baby's breath sounds are clear. You can hear some crackles. That could be the amniotic fluid. Listening to the heart sounds. Then going to the apical pulse. I will be listening to the apical pulse for a full minute, noting the rate and the rhythm. The pulses, or beats per minute, should be 100 to 160 for a normal baby. From there, I'm going to be assessing bowel sounds. So I'll be listening in the quadrants. Left upper, other quad, going down underneath the umbilicus, the other one, and then for the other one. Baby's bowels can range from absent to hyperactive. This baby's bowels were active. Okay, continuing on from there. So I had the breath sounds, the heart sounds, the apical pulse, the bowel sounds, and then the temperature. I'm going to cover the baby back up because I'll be going through a head assessment. I'll be feeling around the baby's head. I'll be feeling the anterior and the posterior fontanelles, looking if they're, say, flat or sunken or raised. I would also be feeling along the sutures and feeling how approximated they are. If it's greater than 1/4 of an inch, that's bad, and you should probably notify your physician about that. This baby's sutures are well approximated. I would go through and I would feel around for molding. If there is some, it's normal. I would just have to note it in the chart. I would also feel around for some caput seducians, or succedaneans. With that, I don't feel any. That can cross the suture line, and it's softer. For a cephalohematoma, which is a blood buildup underneath the skin, it would be firmer, and it would not cross one of the suture lines. It would be more located to one side of the head. From there, I would be looking around and feeling around for bruises, scabs, or say scars. I would continue on with my assessment by feeling the cheeks. I don't see any strawberry marks or milia, and then the forehead is clear of stork bites. I'm going to assess the eyes, and 1/3, 1/3, 1/3. Yes, the eyes are symmetrical, measured from the outer canthus. I'm going to measure from the outer canthus of the eye to the outer canthus of the ear. The ears are placed well. They're not low set on both sides. Ear elasticity, it's an instantaneous reaction. From that's a sign of maturity, which is good. It's on both sides. I'm going to check the eyes and look for any red spots. I do not see any. That's a sign of bleeding, subconjunctival hemorrhage. And I also don't see any golden or yellow for jaundice. I'm going to slowly blanch the forehead. I do not see any jaundice there either. I shall check the patency of the nares, feeling and hearing for breath sounds. From there, I shall don a glove, and I will be testing the baby's rooting, sucking, and assessing his palates. Put the finger like this at the side of the mouth. The baby shall root towards it, and then once it's in the baby's mouth, it'll start to suck. And then from there, I shall feel around on the hard and soft palates for any openings or, like say, indentations. Afterwards, I will take off the glove, and I will feel around the baby's neck using 2 fingers, starting at the back, moving around to the front. No masses are noted. Just check the baby's range of motion by turning the head to the baby's right, and then to the baby's left. The baby has full range of motion. And then from there, what I'm going to do is I'm going to uncover the baby again. And just while I'm here and I have the baby uncovered, I'm going to check the rest of the way for jaundice, chest, abdomen, and inner thigh, along with the eyes and the forehead. Now that the abdomen is exposed, I'm going to check the skin for any, like say, desquamation or vernix. I'm not seeing any. Checking the collarbones. Collarbones are intact. I'm going to be checking the abdomen. It is smooth and flat, along with the umbilicus. Umbilicus is dry and the cord clamp is off. And it doesn't look like there's any discharge from it. I will also be looking for signs of respiratory distress, nasal flaring, retractions, apnea, seesaw abdomen, and grunting. From there, I'm going to go with the arms, and I'll do the recoil resistance. Bring the baby's arm up like this for 3 seconds. Bring the baby's arm down, then let go. The baby's arm shall retract up to here. You can do that for the arms and for the legs too. Continuing on with the assessment, I'm going to take off the baby's shirt. Just so I can look at the baby's back. And I'll also be checking for the vernix again. I'll also be checking for the lanugo. I'll also be supporting the baby's head. Spine's in alignment. I'm going to pull the baby's diaper down a bit. Check that gluteal cleft, which is right there. I don't see any dimpling, which can be indicative of spina bifida. The baby's diaper back up. Now I'm going to check the baby's hands. Fingers are good, and they're no webbing, and they're all there, all 10 of them. Palmar crease, both palms have 2 creases, which is good. Abnormal is 1. Continuing on from there, I'm going to come down, and I'm going to do the feet. Palmar creases cover the whole foot, and Babinski's reflex on the feet. Toes shall flare. Have all the toes are all there. No webbing. Continuing on from there, what I'm going to do is I'm going to get my gloves, and I'm going to assess the genitalia and the gluteal smile. This is a male. If it was a female, I would want to note the labia majora covering the clitoris and the labia minora, also the discharge. Now that I have his diaper undone, I would note any voiding and stool with the characteristics and how much. I would also ask the mother when was his last voiding. Feeding times 2. For the testes of the male, put 1 finger on the inguinal canal and feel the testes. It's descended. Same for the other side. This male still has foreskin, so I would peel the foreskin back a little bit, and then I would check the urinary meatus, and the urinary meatus is centered, which is good. Now I'm going to flip the baby back over now. His gluteal smile is intact, which is good. It means good hip placement. I'm going to put the baby back and wrap him up. While I'm here, I could also do the Moreau's reflex, where I just clap, and the baby will go. Looking at the epicanthal folds of the eye, the baby does not have any, which is good. Be indicative of Down syndrome. And then if I was going to weigh the baby, I would weigh the baby without any clothes on. I'm going to wrap the baby back up and put his jacket on. And once the jacket's on, it'll be all good. Actually, hold on a second. Skin turgor. Yeah, I would check the skin turgor down here, pinch it, and it would go back, and it would be elastic. And that would show good hydration for the baby. And then I would put his jacket back on, and then we would be good.